Jody.
Yes, I'm so sorry. Zoom keeps freezing up on me. I tried it last night and everything worked fine.
Of course, that's how technology is when you need it. Well, I was informed that we have a picture of you that they are going to be showing when it's your turn. So people will still get to see you and not have to look at me throughout the whole thing. Thank you so much for joining us. So I am going to get started, and I am going to just welcome everyone to today's Meet the Healthcare Professional presentation, sponsored by the Center for Healthcare Careers of Southeastern Wisconsin, in partnership with Advocate Aurora Health, Ascension, Children's Wisconsin, and Froedtert Health. My name is Devonna Williamson. I am a talent business partner at Froedtert Health, and I am going to be today's moderator. Our featured topic today is the pharmacy technician role, and it is being presented by a representative from Froedtert Health. The professional that will be sharing information with us today, who we have on the phone, is Jody Evans. Jody, thank you so much for getting in and joining us today. Can you just kind of introduce yourself, please?
Sure. My name is Jody Evans, and I am actually one of the inpatient pharmacy supervisors at Froedtert at the main campus in Milwaukee. I'm actually a pharmacy technician in practice. I've been in the pharmacy field now for about 25 years.
Wow, that's a long time to be in that pharmacy field. And it was as a pharmacy tech. How long have you been a supervisor?
A supervisor since last summer.
Well, congratulations.
Thank you.
Right in the middle of COVID.
Yeah.
So I am also going to just tell everyone who is in this activity today, in this presentation, to feel free to enter in questions in the chat box. I will, try and get those questions answered as we go along if they aren't already on our list of questions. But please remember, you can put questions in the chat box and we will do our best to get them answered. So tell me a little bit about, Jody, can you tell me a little bit about what a work day is like for a farm tech typically? What kind of things do farm techs do?
Sure. They actually do quite a bit, more than I think most people realize. We have about 80 technicians that work, we have about 80 technicians that work on a daily in central pharmacy, and that's not just in our central pharmacy, but that's in like our cancer center pharmacy where they make chemotherapy, our infusion clinic pharmacy, our OR pharmacy, our Drexel and our Moreland locations where they do infusion and chemotherapy. So they actually work in a lot of different areas. We have in central pharmacy, I would say probably about 65 that work in central, and then the other remaining 15 are all over throughout the hospital system as far as our location is concerned. We have pharmacy technicians that can do anything from entry-level positions like delivering medications to the floor, picking medications from our carousels, I'm trying to think here, putting stock away, making non-sterile compounded products, delivering things to our Ptcb machines and loading those up when they're out of stock. And then we have some more advanced level roles, such as we have, it looks like it might actually be trying to log me on now. Sorry. So we have more advanced level roles, such as technicians who make IVs. We have technicians who do, they work the narcotic room where they're distributing narcotic medications to patients and to our Ptcb machines as well. They also have advanced roles where we have pharmacy coordinators. Before I was a supervisor, I was actually a pharmacy technician operations coordinator. And so what coordinators do is they work in different specialized areas. And for operations, we made sure that our actual pharmacy was running correctly. We would take care of any sick calls that were going on. We would handle any troubleshooting problems that our technicians would bring to us. We actually also have technicians that specialize in automation, our Ptcb cabinets, our IV room. I'm actually in charge of the IV room currently, and I've actually been an IV technician now for about 7 years. or I should say 5 years in chemotherapy, 7 years in regular IV compounding. We have technicians that also work in our OR, our infusion clinic, our cancer center. Those are more advanced roles. We have technicians that work in our IDS center. So really on a daily basis, you can be doing a various amount of different things depending on what level you're at as far as the technician is concerned and what you're all trained in. Most of our technicians that work in Central, though, they will deliver medications to the floor, pick doses from our carousels to give to our patients. We have techs that check other techs' work, which we do through barcode scanning. It's called Tech Check Tech or Delegate Check Delegates. And that is an actual program through the state of Wisconsin. Well, it's actually nationwide, but the state of Wisconsin has a special variance for pharmacies that want to have technicians check other technicians' work, which has been nice for the pharmacist because it takes them out of that transactional piece of being a pharmacist where they can focus on more clinical-based work. So it allows them to practice at the top of their license and us to practice at the top of our certifications.
That is a huge list of activities. Two things that you mentioned when you were in there. Yeah. Can you clarify what a Pyxis machine is?
Sure. A Pyxis machine is an automated dispensing cabinet. So basically, if you think about a Pyxis machine, if you've never seen one before, it's almost like a vending machine, but with drugs in it. So what it allows is for the nursing staff to have drugs readily available for them up on the floors when they need them versus waiting for central pharmacy to send them up to them either via tube station or via delivery technician format. So what a Pyxis does is it actually, if a provider puts in an order, it routes to the Pyxis machines first so that nurses can get the medication right away shortly after it's ordered if they need it. If it's not available in the Pyxis, then it'll route down to us in central pharmacy. And then from there, it'll tell us where we need to get that medication from.
Okay, great. Wonderful. So they're going up to the vending machine and filling the vending machine, the Pyxis machine, with the medications that need to be on stock in that area. Okay.
Yep, that's correct. Mm-hmm.
And then you also, most people probably know what this is, but the acronym IV, you said that you overseeing IV. So that's what, intravenous, right?
Yeah.
So go ahead.
No, go ahead.
So are you guys prepping the medication that is going into the patient, or is that what you mean by that role?
Yeah, so what IV technicians do, well, you could call them sterile compounding technicians, is historically in the past, anything that was made in an IV room, such as an IV bag or any sort of injection, whether it's an intrathecal injection, a sub-Q injection, an IV injection, or an IV bag, historically it was made by pharmacists. And actually some nurses would make these products too via bedside, but that was a long time ago. As time has evolved and the recognition that pharmacy technicians can do a lot more advanced work than originally thought has allowed us to grow our field into what it is today. So what that means is that technicians who are certified, at least at our site, when they're certified and they are have gone through most of our core positions in central pharmacy and they're ready to go into the IV room, we have a specialized training program we run for technicians that are either previously IV trained or not previously IV trained. But either way, those technicians, what they do in the IV room or the sterile compounding room or the clean room is what we call them. There's a lot of different acronyms we use there, is they actually prep those sterile IV products that are going to go into the patients. And then our pharmacists actually check them once we make them. There's a huge trust-based system that goes on between a pharmacist and a technician, whether it's an IV technician or any technician that works with a pharmacist. Pharmacists recognize the importance of having their pharmacy technicians because we are considered like the backbone of the pharmacy because we do a lot of the hands-on work, a lot of the transactional work. We help keep the pharmacy running. whereas the pharmacists have more of that clinical-based knowledge, and they have that license and that skill set to check all of the work that we're doing. So when a technician makes something in the IV room, we actually have a program that we recently started using about a year ago called photo capture. And it's actually through Epic, which is our patient database system. And it allows us to take pictures of everything that we do in the IV hoods. We take pictures of every step along the way of what we make until the final product. And then when it goes out of the clean room, the pharmacist will check that final product to make sure that everything looks okay, and they'll sign off on it. Prior to photo capture, we had, there's a couple of different methods that some hospitals still use, because not everybody is using photo capture right now. But we do what's either called the Pullback Method, which is not something we used at Freighter, but it is something I've used at other hospitals, where when we're done mixing something, we will send the syringe out without the needle, with it pulled back to what we drew up and put into the bag. And then at Freighter, we would actually put on our label like what we did, so they had an explanation of how we made the product. It is a very, when you first start working in the IV room, the pharmacist will ask that technician a lot of questions, because they want to get a feel for what that technician understands and how they're doing, and you know, if they understand what they're making and the process behind it. The technicians that train in our IV room are all lead IV technicians who have been doing IVs for quite a few years, and some of them have 20 years experience under their belt. So we're very particular about how we do that training in there, because those medications are so important.
Right. No. Yeah, that sounds like exactly what it should be. You mentioned certification. So what sort of training or education is actually required to become your basic farm tech?
So in the state of Wisconsin, there's actually nothing required, which is kind of a sad situation, where one of, I think, like 5 or 7 states that don't have any like legal requirements as far as working in a pharmacy. But most employers, and especially the large hospital organizations, are starting to require what's called Ptcb certification. So Ptcb certification is through the Pharmacy Technician Certification Board. It's a national certification, and it's an exam that you take, and it's all based on pharmacy practice. The way you used to be able to, in the past, you used to be able to just go sit for the exam and you could take it, and anybody could take it. You didn't have to even work in a pharmacy. But now they require you to have some sort of pharmacy training or some sort of pharmacy education prior to sitting for the certification. So we actually have an apprentice program that we run at Freighter in conjunction with MATC, where if people come in with no certification and under 2 years of pharmacy experience, we actually put them through that pharmacy technician apprentice program, which is actually a state approved apprentice program now as of last year. And our technician apprentices, when they start with us, they go to MATC for 16 weeks. It's on a semester basis, so either in the fall or the spring, and they go for 8 hours a day on Wednesdays, and that 8 hours is considered part of their work week. So then the other 32 hours, they actually work in our pharmacy getting their practical experience, and they get their didactic or education experience through that MATC apprentice program.
That's great. So they can come in with a high school diploma and then go through this program basically as part of being a farm tech with Freighter in this case.
Yep, absolutely. The only requirement we have at Freighter is that you be 18. So some of those, I know when I graduated, I was still only 17. So, you know, there's those students that have, I mean, that might be something we could look at. I don't think we've ever had anybody apply at 17 yet, but yeah, most everybody that comes to us either is in college or they're done with high school and they're looking to become a pharmacy technician. Mm-hmm.
Cool. Very cool. So what skills or abilities do you think make someone a good farm tech?
I think to make somebody a very good farm tech, you actually need a few different skills. The first skill is critical thinking. It's really important that you be able to look at the big picture and kind of think of things and problem solve as far as how you get through a situation, because sometimes the answers are not always going to be in front of you, and sometimes that's just through experience too. The other thing is math is a very good experience, or is a very good skill to have. We are a pharmacy-based area, and pharmacy naturally comes with doses and mills and all of that type of thing. So knowing math is a good skill to have, but I mean, we do have technicians that are not strong in math, and they work through those. You know, we give them the tools that they need to get through that. But most importantly, I think, is having good communication and teamwork and a great attitude. We like to foster a positive work environment in the central pharmacy. We recognize that most of our teams spend a good portion of their life at work and their work weeks. And so we like to make sure that the experience is enjoyable to them. And we like to make sure that they're coming to a place where they enjoy coming to work, and everybody pitches in as a team, and everybody recognizes the value of kind of pinging off of each other anything that they might need help with.
Okay. So are there any suggestions that you would give specifically to a young person who is thinking, maybe I want to become a farm tech? What should they maybe be studying? Are there any roles that they could do while they were in college? Maybe, you know, if they decided to go the college route?
Sure. So we have some technicians that are in college. Some are actually in college for pharmacy school. MCW has a really great program that a lot of our technicians go to just because it's right there on campus. But you could do anything like pre-farm, biology, chemistry is a good one, mathematics. So anything in the sciences is really a good one to get into, but that's not necessarily discounting anybody that is not interested in the science field, because I'm going to be honest with you, I actually have a bachelor's degree in history. I was never strong in science or math. And I actually ended up becoming a pharmacy technician at Walgreens when I was in college. So that's how I ended up in the field. And I left pharmacy for just a little while and was a paralegal for about 9 years. And then I came back into the pharmacy field. And I actually like pharmacy a lot better. I really enjoy what I do. I know I'm helping people, but without having to touch patients, because I'm not a big, I'm not a nursing person, let's just put it that way. But what I do like is that I'm able to help patients, and that I'm able to, I feel like I'm doing good every day. And whether that's working with my staff to help them fulfill whatever dreams they have, whether it is staying with pharmacy or moving on to other healthcare professions, or whether it's just being there to make sure things run efficiently so that I know our patients are getting what they need and our staff have the tools that they need to do their job. But most importantly, I think for me, I'm always a pharmacy technician. I might have the title of supervisor, but if my technicians in the IV room need my help, I'm going to run in there and help them. Tonight, I'm staffing workflow and checking other technicians' work. So at the end of the day, it doesn't matter what my title is. My core is pharmacy technician, and it has been for 25 years. And I personally just think it's a really good field to get into because it's a growing field. We here at Freighter are very technician focused. So we like to advance our technicians as high as they can go. And I was going somewhere with this and I just lost my train of thought. Oh, it's a growing field, and we continue to grow the different types of tasks and responsibilities that pharmacy technicians do. So we keep pushing the limits here at Freighter to see how far we can utilize our technicians and how advanced we can make them, because we do recognize that with some advanced degrees, so for instance, like I have a master's in healthcare administration. So with that master's degree, I was able to obtain a position as a pharmacy supervisor, which normally a pharmacy supervisor or pharmacy manager position is historically been held by a pharmacist with a PharmD. But because I do have the experience that I do, and I do have that advanced degree, and I am a certified pharmacy technician, it has allowed Freighter to explore creating some more higher level advanced roles for people like me who are kind of like your non-traditional pharmacy technician, I guess you could say.
That's great. Well, you touched on this a minute ago, but I'm going to ask you the pros and the cons. What do you like most about your job? And then, of course, the con side. What do you find the most challenging part of your job?
So what I like most about my job is helping people, whether it's the patients, the nursing staff, or my staff. in general. I like being that go-to, and I especially like advancing technicians in their career because I have a very big passion for this profession, just because honestly, I don't think I would be in it for 25 years if I didn't. But I actually teach in pharmacy technician education at Gateway Technical College as well, besides my job at Freighter. And so I'm very involved with educating technicians, getting them the tools they need to advance in their profession, and encouraging them to make it their profession.
One of the questions I did want to ask you, Jody, also was, realistically, why is your role important to healthcare?
I really like that question because I don't think that a lot of people understand what pharmacy technicians do and what our profession is. And I think that's because historically we didn't really hold a very important role. We mainly did just assist the pharmacist with, from an outpatient standpoint, we would just, count pills and put them in a bottle and ring register. But now we do so much more in even outpatient settings than we used to. But from a inpatient standpoint, I'm going to be honest with you, and my pharmacists always laugh at me, but they agree that the pharmacists could not do what they do without us, although we can't do what we do without them. So it's really kind of a team effort. But I think what we bring to the table in healthcare is extremely important, especially at a time like this during COVID, when patients need medications, whether it's the COVID vaccine, which we are currently involved with right now, or whether it is whether it's medications that patients need while they're being hospitalized for COVID, or just medications in general, because at the end of the day, people cannot get better, especially when they're hospitalized, without their medications. And nursing and physicians and respiratory therapists and physical therapists and everybody else involved in a patient's care could not take care of the patients in the manner in which we do without those medications. So I do think pharmacy, just in general, brings a very important aspect to the table that I think sometimes people forget about. I think sometimes people take the fact that drugs are just readily available to us for granted, but they don't realize where those drugs come from, because if we didn't have pharmacy, we wouldn't have those drugs. But most importantly, and what I've seen over the last probably, I would say 10 to 20 years, which I think is fantastic, is not only more involvement of pharmacy technicians in more interdisciplinary work groups as far as patients' care is concerned, but also the pharmacists and how well the other healthcare professions welcome the pharmacist into those interdisciplinary groups as well. So when there's rounding in the morning up on the floors, the pharmacists are involved with that, because I think it's extremely important that pharmacy does play a role in that, because when we're discussing a patient's medication, or if we're going to change a dose, or if we're going to take them off of something or put them on something, we really need to have pharmacy involved in those discussions, because the pharmacists went to school for that, and they're the ones that are going to be most well equipped to answer those questions that providers might have regarding a patient's medications, whether it's stuff they're bringing from home that they're on, or stuff that we're going to be giving them inpatient.
Well, and you touched on it just now when you said interdisciplinary, but one of the things that I did have as a question for you was, like, how involved are you with direct interaction with the patients, or are pharmacists the only people that you work with? Like, who are the different kinds of groups that pharm techs interact with?
Sure. I will tell you, granted, we are very involved with our pharmacists, obviously, but a big portion of who we work with is the nursing staff, at least from an inpatient standpoint. Now, if you work outpatient pharmacy, that would be more like providers that you would call on the phone for, refills or something like that. But usually we would fax them though. But anyways, nursing is, like, when I look at how I was in retail at Walgreens, I consider nursing staff my customers, because they are the ones that are directly interacting with us, telling us what they need for their patients, and if we're out of stock up on the floors, or if they need it tubed to us. But with that said, Well, I don't have any direct patient involvement as far as, entering patients' room and talking to them. We do have we do have pharmacy technicians that do such jobs as like medication histories, where they will interact with the patients directly and their families, getting a full medication history workup before a patient either gets admitted inpatient or if they are going into a surgery, so that the providers or the surgeons know, what that patient is currently taking, and making sure we have that put into our Epic database correctly. The other thing is we do have what's called our medication access specialist, which that role is kind of different depending on what location within the Freighter community you go to. But here on the Freighter campus, we actually have our medication access specialists. We used to call them decentral technicians. So what they were is they were a link between the outpatient pharmacy and the inpatient pharmacy, and ensuring that that patient has all of the medications that they need before they go home from the inpatient setting, to make sure that they can continue to stay compliant with their medications when they leave, and hopefully don't get readmitted into the hospital. So what they do is they work in the background on making sure any medications the physician would like to see the patient go home on gets approved by their insurances. And then also we try and get the medications filled for them at our 92nd Street pharmacy on campus, so that they don't have to make that extra stop on their way home to like a Walgreens or a CVS. They can, we can get them their medications at the 92nd Street pharmacy. Our medication access specialist goes down there, retrieves the medications. It's all paid for by their insurance, and then whatever co-pays and stuff, they manage to do that with credit cards or however they do. I'm not exactly sure how that all part works, but I just know that they're responsible for helping facilitate getting those drugs up to the patient before they get discharged, so that they can take those home with them.
So definitely a lot of interaction with a variety of people, it sounds like. We had talked a little bit earlier prior to the quiz about what you like. I don't know that we got to what you find to be challenging about being a farm tech. You jumped right over that, Jody.
Yeah, I I'll be honest with you. Honestly, there's nothing I don't like about being a pharmacy technician. It does have its pitfalls sometimes. I will admit that when, and I have to tell this to my students all the time too at Gateway Technical College when I work with them, and even our apprentices when they first come in, pharmacy, especially at a hospital, is 24/7. So that means the hours that you work are usually going to be a mix of first and second shift. There are very few hospitals that have set shifts. Now, we have third shift, but we don't require our people to work third shift. We will fill in from leadership if we need to, if it gets that short-staffed. But we usually rotate pharmacy technicians between first and second shift. And I know a lot of my students are looking for Monday through Friday, 8 to 4:30. And in healthcare, there is no Monday through Friday, 8 to 4:30, not from a nursing standpoint, not from a clinical standpoint, not from, physicians work overnight. I'm going to be honest with you, I'm more of a night owl, so I prefer second shift, which is why I'm at home right now talking to you guys, because I work tonight second shift out in Central. But lots of my technicians, they rotate between first and second, and we work weekends, we work nights, we work holidays, we work it all. So if you're already working in retail, you kind of get used to that, so it's really not that big of a change. But for people who come out of college, sometimes that's the expectation, that they want that Monday through Friday job. And when you're in healthcare, people get sick 24/7, it doesn't stop. So yeah, that's really the only, I wouldn't say it's a pitfall for me, because I like my mixed schedule, but a lot of people, it's not something they always like. So
yeah, healthcare is 24/7, 365 days of the year. So yeah,
it is. It's just like when your kid gets sick, they're all,
you want to be able to get help for them. Right, exactly.
Yeah, and you don't always get a break yourself as a mom. So
right. So you talked a little bit about what sort of things people could study to make them ready to be a farm tech. What sort of traits do you think make someone a good farm tech?
I think that's kind of for me, that's kind of a loaded question. The only reason is because I have a lot of different types of technicians that work for us. We pride ourselves in being very inclusive, meaning we welcome everybody, and we it doesn't matter what your skill set is, we can usually find a position for you. So we actually work with a program called, I'm going to kind of go a little off topic here if that's okay, but we work with a program called Project Search. And Project Search is through Easter Seals, and that allows us to have interns that come in who have special needs, whether those needs are social skills, or maybe they have some physical disabilities. They have some sort of disability that they have that has allowed them to become part of that program. And through that program, I think it's been great because we have incorporated 2 of our Project Search interns are now pharmacy technicians, and they're both certified. One very bright, but social skills are just, there's a lot of social anxiety there, so there's really nothing wrong. He's actually one of our IV technicians. He's fantastic. His math skills are beyond anybody I've ever seen before. So, and then we have another one where he is really just a delivery tech for us, and he does a great job at it. But some of those advanced roles, it just might not be a suited fit for him, but he loves what he does. And then we also have 2 pharmacy assistants that help us with tasks that we can't get done as pharmacy technicians, and you don't have to be a certified technician to do. We got them through Project Search as well. We have a technician who is deaf and does sign language, but she can also read lips, and she also does have some residual hearing, so she does wear a hearing aid. I actually have a completely deaf student at Gateway right now who's going to be doing her clinical work at our campus in the summer. So, and then we have just technicians from all different backgrounds, all different age groups. We have technicians ranging from anywhere from 18 to, I've got one that's getting ready to retire at 68. So the thing I like about it is because we have so many different skill sets and so many different levels of the way people think and the way people do things, and the age groups and the difference in age groups, is that we've all been able to learn from each other in some way, shape, or form. So we pride ourselves in being very diverse. We really enjoy having our diverse team. We think it makes us a much stronger team, and we also think it makes us probably one of the most that stand out at Freighter as far as being welcoming to diversity and inclusion.
So that's great. It's great to hear about inclusivity when it comes to age, when it comes to background, when it comes to what someone's strengths or abilities are. So it sounds like there's maybe a niche somewhere as a farm tech, no matter what your strength is.
Yeah, I mean, we have some technicians that they're perfectly comfortable doing what positions are already assigned. Some of them do not want to go in the IV room. Some of them, like I never wanted to be in the NARC room, and that's okay. We work with those kind of things because everybody has their niche that they're strong at, and we find what those niches are, and we kind of hone in on them and encourage them to kind of build off of that.
And a NARC room would be a narcotics room?
Yes.
Okay, yeah.
Yes,
I've been watching, crime shows, so I figured that's what that one was. But,
Yes.
One last question that came in the chat, and they just wanted to kind of re-verify. It seems like that the question is, it seems like a high school diploma can be used for this job as long as basically you're 18, as there isn't a license right now, but that it sounds like Freighter specifically is going to want you to get that certification when you come in.
Yeah, that's correct. So if you come in with 2 years or more of experience, you can bypass that apprentice program, and you would have 6 months from the date you get hired to get your certification. You would come in as what's called a Farm Tech 1. Most people, however, that we get don't have 2 years of experience in pharmacy, or they just don't have any experience in pharmacy, which is completely fine. There's nothing wrong with that. What you would do then is you would come in as a pharmacy apprentice or a pharmacy tech apprentice, and then you would actually go through the tech apprentice program that we have in conjunction with MATC. And we actually fully pay for that. It is a recognized program through Ptcb because it's a kind of abbreviated version of what Cindy Steffen, the program director at MITC for her full program, has set up. She's brought it down and abbreviated it for our technicians so that they can pass that certification exam, but it is PTCB recognized. They do get a certificate of completion when they're done with the program, and then they can sit for the exam. They have 6 months from the date that they graduate the program to sit for the exam and pass the exam and get certified.
Wonderful.
And just an offset, I know a lot of hospitals like Aurora, I believe Ascension is doing it now, are all requiring their technicians to get certified within a certain amount of time, just because in the background, the state of Wisconsin is looking at possibly either requiring certification of pharmacy technicians or possibly registration or licensing. It's looking more like registration at this point, where you would just be registered as a pharmacy technician with the state, so you would just be on a list. So they would have some record of who's actually a practicing pharmacy technician in the state. But I think eventually down the road, the state of Wisconsin is going to require some sort of certification and possibly licensure in the future. That's kind of the direction a lot of the states are going.
And that's the way that Jody wants it to go. I can tell. You said earlier.
Well, I would like it to go that way just because we do have such advanced roles now. It makes sense.
Yeah. Jody, I really appreciate you fighting to get into this lecture presentation, doing it via phone and then getting on the video. I appreciate you doing that and taking time with us today. Everyone, who has attended and been involved, if you do have any further questions that maybe Jody can answer, you can email joan.ward@employmilwaukee.org. Or you can, reach out to the Center for Healthcare Careers of Southeastern Wisconsin, either direction, but Joan will definitely get questions out to us. Again, joan.ward@employmilwaukee.org. And if there are questions regarding a farm tech, we know that Jody will be the one who can answer those questions. Thank you, Jody.
No problem. Thanks, guys. Thanks for being so patient with me.
Thank you, everyone. We appreciate you listening today. Have a good evening, good day. It's afternoon, so have a good afternoon. Bye-bye.